passes around 2 million neurons just died. If we can see the clot on the CT angiogram or on the CT head. Hello and good morning or good afternoon. Welcome to my channel, guys. Welcome to Nursing Stroke Medicine. In this channel, we're going to talk about stroke, unfortunately, the disability that stroke leaves to people, and how we can be more aware of stroke when it hits. So basically, stroke is a sudden neurological function loss due to a clot or a hemorrhage. Like a clot is blocking the main arteries and blood cannot go through, and in that case the tissue starts dying, being deprived of oxygen. And also another type of stroke, it's a hemorrhage when an artery bursts due to, could be, in most cases it is arterial hypertension. We need to talk about how we can be aware of the symptoms, and also a bit of short history how we got to know a stroke, and basically how it all started and us being aware of it. It all started probably the 5th century BC by Hippocrates, when the first cases were documented. They didn't know exactly what was going on back then, but they just find people collapsed basically on the streets. They went to Hippocrates, that's the story, and they asked him what's going on. And basically Hippocrates came with a diagnostic of apoplexy, which back then in Greek times it's called struck with violence. This basically is describing how they found basically the bodies, but not really, they didn't have a clue exactly what's going on inside of the brain. Although later on, a few centuries later, a pathologist and a pharmacologist by the name of Johann Wepfer, basically, while he was doing autopsies, he found actually how this apoplexy occurred, and they discovered back then it's either due to a clot blocking the vessels or an artery burst having hemorrhagic phases, basically. Right. And that's the short story. Probably it's a bit more, we're not gonna go in depth about it. We're gonna talk about how we can be aware of it. So basically we do have, you can see it right on the ambulances, the FAST test, face, arm, speech, and time. Basically time is brain, and basically every minute passes around 2 million neurons just die having the stroke. What we can what we can do to try to teach the members of the public to spot those symptoms faster and basically help the patients. How we can do that? Well, that's simple. Usually a stroke occurs giving you a unilateral facial weakness, arm, leg weakness, speech disturbance, also called slurred speech, or in medical terms dysarthria. We can be a bit more aware, having in mind stroke is the 4th leading cause of death and 1st leading cause of disability in UK. I think we need to emphasize more in picking up those type of symptoms and attend hospitals as soon as we can. And pretty much FAST test, also called in emergency department ROSIER score, it's basically telling us likely a stroke is occurring. ROSIER comes from recognition of stroke in emergency department. What we can assess, it's not a diagnostic tool, but what we can assess about the patient when we are approaching with this type of assessment is Basically unilateral weakness. We can assess speech and vision disturbance, and that might get us a likely stroke diagnostic, or unlikely, depending if those symptoms come with loss of consciousness or seizures. Having in mind big strokes like an hemorrhagic stroke, a large hemorrhagic stroke, and a brainstem can cause seizures, we can only see that by doing diagnostic imaging like a CT of the head. So we're gonna go back to ROSIER. So every time, basically, if the patient has 1 point for speech, 1 point for leg, arm, vision disturbance, and as soon as that patient scores from 0 and above, that means that the patient is likely to have a stroke. But also if it scores from 0 below, like -2, because also a seizure is with a minus on the ROSIER score, and also loss of consciousness is with 0, it can score up to -2. -2, unlikely to be a stroke, but also it doesn't fully exclude, so you still need to do a CT head scan if the symptoms are ongoing, and basically get to the bottom of it. What we know about stroke in hospitals, basically in around, I do believe it's around 80s. In the 80s, Los Angeles came with in America, they came with a good system of approaching cerebral vascular attacks to patients. Basically, if you have a vascular attack outside on the street, they have something called chain of recovery, which was we are basically following it here, probably under other name, or probably under FAST. Basically, what chain of recovery means is all the elements that can align together can get the patient into a recovery status and basically rehabilitate him. So basically you had the EMEs in the chain of recovery, basically paramedics attending the call by the members of the public, and then you have the hospital, the emergency department, which is receiving the alert, and then they put the acute stroke call or a fast call, whatever the hospitals are using depending on the trusts, and then the stroke team arrives, led by a stroke nurse, a doctor, a stroke specialist doctor, a consultant, and basically do the investigations assisted with specialist input. What is very important though is time. In strokes, time is brain indeed, and we need to act fast. What that means basically is having the scans, bloods, ECG as fast as we can. ECG can wait, but bloods, scan, and assessment, we need to do it straight away, so we can see if the patient is for thrombolysis or mechanical thrombectomy, if there is any target on the imaging that we can retrieve. Right, so we basically covered time basically. In regards of it, we have 4.5 hours window at the moment. It might change by the NICE guidelines in UK, but at the moment it's 4.5 hours for thrombolysis. So if we have the symptom of onset of 4.5 hours, and the specialist stroke consultant says thrombolyze, we as stroke nurses, we proceed with that, having in mind the patient has no exclusion criteria that might contraindicate a thrombolysis pathway. And then obviously if we have a target for the clot, so if we can see the clot on the CT angiogram or on the CT head, then the patient qualifies for mechanical thrombectomy, which is one of the main new breakthroughs in stroke, which constantly evolves and is very efficient also for patient recovery if we catch it in time. My name is Christian Filote. I'm a clinical nurse specialist in stroke, and this channel was created to raise stroke awareness and basically act fast when it's needed in regards of stroke. Time is brain, and stay tuned and keep an eye on my next video, where we're gonna cover something very important that members of the public needs to be aware of. Cheers, kind regards.